Good morning, everyone, and want to call this meeting to order. This is the Policy Review Committee for July 31st. Why don't we start with roll call, please?
Chair Brown.
Here.
Board Member Cole.
Here.
Dr. Pierce. Ms. Beasley. Ms. Klein.
Present.
Ms. Ellingson.
Here.
Mr. Holt. Ms. White.
Here.
You have a quorum.
Wonderful. Welcome back, everybody, and thank you all for your willingness to meet again so quickly. We've got just a few items on this agenda. The first of which deals with face coverings.
Yes, thank you.
And Dr. Roush has just put up the proposal. And let me just ask well, Dr. Roush, what's marked up here, and why don't you present this?
Certainly. When the governor released the state's guidance for K-12 education, amongst that guidance was a requirement that we adopt a face mask policy. We worked one up, and then Neola subsequently on Tuesday released their their guidance and version of what a policy would be, which was a lot longer than this. Because we'd already posted 8,000, and of course you've seen that there's a change in the policy number. That's because that's what Neola is going to give it the number no matter what. Again, we use that kind of 8,000, 2,000 placeholder number while we wait for Neola to give us a policy number. Because we'd already placed that out for the Policy Review Committee, the green are some aspects from the Neola policy that we thought actually made some sense and helped clarify some items within the face mask facial coverings policy. A lot of this is lifted directly from the document that the governor's office put out. It's in many instances verbatim. A few other, there's a few other smaller pieces that give, the preamble's our own, and kind of indicates when that may be. Again, it makes it, this is a May policy. And so, excuse me, Dr. Pierce is joining us. Sorry, I'm going to take note of when she's joining us here. So that if local, federal, state health officials indicate that facial covering should be worn, that then kicks into gear, the superintendent can go ahead and do so with established guidance. And so this kind of sets the parameters of, yes, we're going to have a face mask policy. Here are the exceptions that are supposed to be in that policy that the guidance indicated, and then really the guidance that will come out from the superintendent built upon this policy framework will really serve to dependent upon what those recommendations are from health officials, because today it's COVID-19 and tomorrow, unfortunately, may be something else, and there may be different guidance. And so we want to be nimble based upon what that particular pandemic may be, to be able to adjust accordingly. So again, this is a requirement from the state's reopening guidance. We have to have a facial covering policy.
Very good, thank you. Any questions or suggestions? Oh, let's see. Phil Hayes is putting some thoughts into the chat.
If the committee feels the need to necessarily, and I can, oh, I just lost the chat bar. I'm sorry. Let me bring the chat bar back up here. Mr. Hayes notes that the policy speaks to staff being required, and then there would be discipline if they fail to wear them, but not discipline for students if they choose not to wear a mask. We could certainly clarify that here in the policy if we think that that needs to be there. That's they have to apply, they have to adhere to the meet the requirements of the student code of conduct, student discipline code regarding that. And so that would be built into the guidance, obviously, and built into those codes. But if we wanted to further call that out in this policy, we certainly can do so. I defer to the committee on that, but that the student code of conduct, student discipline code is where that discipline piece for students falls into comes into play.
Anybody have thoughts about that? I don't know that I don't see any downside to clarifying it here in this policy.
I would just simply add to the very last sentence then, students is it and or here, folks? I'm sorry, what preposition do we want to use?
Or.
Okay.
Maybe any student or staff who violates.
Mm-hmm.
There's
Well, go ahead.
There's a minor typo in the number 6 on the exceptions.
Mm-hmm.
Not to wear.
Not to.
Need to remove one of the two.
Good catch.
I wonder whether we might want to include a specific reference to our disability accommodation policy, both for staff and visitors, just to bring that process in if somebody's requesting an exception for a disability related reason, just because that process should respect an individual's privacy, but also it sort of highlights that if this is a disability related need, then it needs to go through that process.
So that second to last sentence, and it's employee specific, and so again, this may be another good example of where we want to add student. Do you just simply a student or?
Yeah.
So in considering the request, the district administration may discuss other possible accommodations consistent with the ADA.
It's going to be 504 of the Rehabilitation Act for students, or potentially parents or other visitors. But the relationship is a little more intense for students and staff who are there every day. But just to introduce that concept that we have existing law and policy to deal with situations where somebody needs an exception from the general rule, and where that's going to involve a medical issue, both of those laws require that any information be provided be kept confidential. It's not widely shared and things like that.
Does that help to say consistent with ADA and applicable board policies?
It's going to be 504, the Rehabilitation Act for students, though. So the ADA Title I is what protects staff members and employees, and also 4112, Ohio's employment law. But presumably we've got existing policy though that already
We do.
we could just refer to our policy and say that's the procedure that's going to be used in addressing a need for accommodations as an exception to the policy or reassignment, as paragraph 3 mentioned.
So we would simply say, in considering the request, the district administration may discuss other possible accommodations consistent with applicable board policies for the student or staff member.
Once again, there are parts of this like may discuss, like in the disability world, that, you know, for an employee, that would be the interactive process. For the students, that would be a request for accommodations under 504. So I don't think discuss is quite strong enough. I think, you know, in considering their requests, maybe the administration shall, you know, apply our whatever policy we have on that to sort of steer it towards that policy.
We have several policies in that regard, dependent upon, we've got, I think, 3 or 4 policies, which is why I just went with applicable, because we've got several, because it depends upon the class.
Okay.
But I can make this a little, in considering the request to the district administration, shall consider other possible accommodations consistent with applicable. Do we get rid of the commas then, do you think, to get rid of that?
Yes.
Parent.
Once again, the considering possible accommodations, like that's part of what the procedure should be. But here I'm thinking that rather than spelling out what that procedure is, because it's going to be slightly different for an employee than a student, why don't we just reference and just say all of these requests will go through the applicable disability accommodations policy? Because if once you get into shall consider, then there's the question of, okay, you know, is that the interactive process? Is the district receiving feedback from an employee about what would suit their needs? You know, I would just want to make sure that whatever we have here is going to respect the needs of our students and staff with disabilities, which has, you know, there's a more robust interactive process required there. But just making sure that this policy sort of steers folks in the right direction so that that policy is being followed.
Does that work? In considering the request, the district administration shall adhere to the applicable board policies for the student or staff member regarding such accommodations?
So I think that sounds very good. And I think these are excellent points to note in the revisions of our policy. Emily, thank you so much for ensuring that we have consistent alignment with the policies that we see happening in other institutions and with accommodation laws.
I agree. Thank you.
So can someone from the district kind of walk me through what it would look like if, I hate to even ask this, but we're aware that some people would like to maintain they have a health condition not to wear a mask when that isn't the case. And yet it is our job to, Emily, I won't even try to articulate what I know you could say in a second here, to respect their privacy about their health matters. So how will the district confront a situation in which someone says they do need an accommodation, they should not have to wear a mask, but there is no underlying health issue? We confronted this a little bit at the city, and I think there was a recommendation that perhaps they keep some sort of note explaining that, without stating what their health condition is, that they have one from a doctor or perhaps a school nurse. I know I'm leaning more towards students at the moment, and it's unlikely to be the case that they're in the building anytime soon. But I think it's important to have a process in mind should that sort of challenge come about. So do you know what that process is?
And typically those processes that they would get a note, if you're thinking students, that there'd be a note brought in. Again, then can be, as you know, as long as it's from a licensed physician in a health situation here, stating that or appropriate healthcare professional, that would be sufficient for I believe that would be sufficient here in this case. That's part of the guidance that'll be developed here. I know that Health Services is already working through that. I think has a pretty solid process. I think they're just making tweaks to it for the masks. But
I-
go
So
ahead.
could I just add, I think Kelsey brings up an excellent point, and I think we need to think beyond the students, but also think about how this might affect staff in and out of buildings as well as visitors. Is it possible that HR could provide us with some of their ideas, recommendations prior to the board actually approving this policy?
I just wanted to throw out, I totally agree that getting some more on the ground info about how these requests are currently processed is really important. But I'm a member of the Disability Rights Bar Association, so I do represent folks with disabilities who have who want to go to work and need accommodations to safely do so. And some of the issues that people in the community have been raising where they might need accommodations are like some folks are missing their ears. It can be difficult to wear a mask in that situation. Other folks have claustrophobia or other issues with having a mask touch their face. And then also for students and staff who might be on the autism spectrum, there might be sensory issues around wearing a mask. On the other hand, there are many people in the disability community who feel very strongly that who are more vulnerable to respiratory illness and also have strong thoughts about the importance of protection of masks for others. And then also I think that there's like widespread alarm and disgust at folks who would utilize the civil rights law to when they don't have a medical need, kind of akin to somebody who, parks in the accessible spot or claims that their pet is a service animal so they can go to brunch. So nobody wants to see that either. But I think also folks don't want frontline employees asking intrusive medical questions or coworkers asking intrusive medical questions, which always comes up with individual accommodations. But ideally, it would be a matter of an interactive discussion between the employee and somebody with HR in a way that respects the individual's privacy. The ADA does permit an employer to require medical documentation. But I think it's also important to think, like, for instance, if somebody were missing their ears, they might have been born with that condition. Having a medical personnel, report that now, they might not even have a doctor available to establish something that's pretty obvious. So all of these are going to be, they're necessarily going to require a judgment call. But the important thing is that that medical condition and all of that process is handled confidentially. But also, this is actually an important health policy. So it should also be taken seriously, and a request for that kind of accommodation should not be made frivolously or without any basis.
So thinking of all those concerns, will we feel comfortable, again, having a presentation from our district HR? And Dr. Roush, I'm thinking of Myra Wright. Would she be the correct person to give that overview presentation?
Myra or someone on her team, depending on how she wants to delegate that if she doesn't want to do it, but yes.
So will we feel comfortable with them presenting that to the board, or would we advocate that they present that to us before this policy is even taken any further? Because it sounds like we really want to know what the process is.
We can provide that process at we can provide that update at any particular time. We can provide that to the committee. We can provide that to the board if you feel comfortable enough sending the policy to the board, but the board knowing that the board's going to need to have some additional information before it feels comfortable adopting this. We could do it that way. If the committee wants to hold on this policy and wait until the August meeting and tackle this issue, then we can do so. There's still time to try to get this in place before students return. Well, students aren't returning necessarily until after the end of the first quarter here, but we will have staff starting to return, and so having a policy in place for staff when they start returning to the building is going to be very important. So,
Well, I think this policy is also important given that we have students that are currently engaged in athletic practices. So we do have staff interacting with students. And then we also have a question from our state OPC president, Miss Lois Carson, who has questioned, can we wear the clear face mask? I think a lot of people at Lowe's are starting to wear those now at different grocery stores.
So as we've had those conversations, that would come out in the guidance that would be something that could be considered there. Again, we lifted this right from what the state had. We didn't want to go too much farther from that. Again, if you put we could put face shields in the policy, but for the next event, if they say face shields don't work for whatever reason, then we've already given the okay that face shields are good to go. And it would take an action of the board to repeal that particular section. We felt that items that particular were good for the guidance. These
Well,
6 exceptions were what was put into place in the state's requirement that we have.
Just a quick question. Why wouldn't a face shield, and I don't know that it needs to be stated succinctly in the policy, face shield, but why wouldn't it qualify as a covering? So we have in the language facial mask / covering. Why wouldn't it qualify as a covering?
If you look further down, it does say it needs to cover the individual's nose, mouth, and chin. The face shields, I'm not an expert in this area at all. I will admit that, but I know that there's a question: does the face shield adequately cover the nose, mouth, and chin? Because there's an opening at the base. So is that sufficient? That's a health medical question and outside my wheelhouse, but that's just some of the concern I know I've heard with the face shield is, does it meet that particular definition that's in here? Although it's been discussed, is that an accommodation that could be made? Because again, is there a practical reason for them to wear the face, not wear the facial covering? So is that a good way to do it? For instance, if we're teaching language acquisition skills to EL to our elementary learners, we're seeing the mouth and seeing the motions of the mouth forming the sounds phonetically is an important thing. And so in those instances, is it a face shield? I know that they think the district is looking to procure or perhaps has already procured face masks that are clear. So there's actually a facial covering, but it's like a clear plastic. So even with the mask on, you could still see my mouth moving and formulating the sounds. So there are other options besides just the face shield. But again, I think those kind of nuances are probably better set in guidance than necessarily the policy.
Dr. Rausch, I'm similarly out of my lane here, not a trained health professional, but I think part of the reason why the focus is on masks, I mean, if you get into the weeds about it, it should be close fitting. You recall that I'm protecting other people when I wear a mask, because when it covers all of those areas and is close fitting to my face, it is filtering the small particles that are dangerous to others. So if you picture a face shield, that might, if you're a nurse and or a doctor helping a patient, maybe in surgery, that protects large emissions, call it that, from striking you, but it doesn't actually filter your own particles out of the shared airspace. So I think that's the difference there. And from what I have observed, face shields are above and beyond face masks, but they don't really, they don't replace the need for a face mask.
Thank
Probably a good question for Ms. Kate King.
Right. I think that those kinds of nuances really need to be handled, individually in most cases and outside the policy. I think the guidance and the professional judgment of our school nurses and other health professionals needs to guide all of that. And I'm not sure that it makes sense for us to get more specific in this policy.
I kind of agree. I mean, I would like to know what the wheel looks like, maybe with how these might be addressed, but we don't necessarily need to reinvent it. We kind of just need to point that direction to make sure that this is essentially an accommodations request for a disability related reason. Let's just treat this request as we do in in all other cases, and we have employees and students with disabilities all the time that get accommodations, but making sure that that personal privacy is respected, that the request is taken seriously, and that it's handled in an interactive way, is important. And especially because it's essentially an exception to whatever the rule is. We don't need to determine in advance and without input from an individual about their needs, what the range of permissible options is going to be.
And I just got a text back from our executive director of HR who I asked the question. He said they would ask for an accommodation and go through the interactive process. He said the process is the same. So we have a process in place. We just follow our normal protocols in this regard. And I'm not an expert on what all those protocols are. I don't work in HR, and God bless those who do, because I know they have it's not my bailiwick. They probably look at policy and say, "I'm glad you're doing policy," but they do follow the. They already have a process. We follow the existing process and protocols in that regard.
Now, that existing protocol will handle staff requests for accommodations. What's the existing protocol for the student request?
So student requests would I mean, we have the 504 plans that exist, and so those requests would go through that IAT process. Again, it's fairly well established. They'd make the request, and they we get health services involved. So I know that Kate King and her team would be involved in those discussions as well.
Let me ask a little bit different question, and only because I guess I have recently read about incidents where people wear masks with inappropriate markings. For example, the folks that wore swastikas on their masks. I'm would guess that our policy, dress code policy, would cover that, and that we don't need to get into it here. But I just want to raise that and see if anybody has different thoughts about needing to do anything more here.
That's why it was actually we added that in. It was part of the Neola guidance that came out. We're like, oh, it's a really good call out here, is to make sure that the face masks do adhere to our dress policies, our dress and grooming policies, for that very reason, to try to make sure that we don't have inappropriate sayings coming in, I guess, on the face masks.
All right. Well,
or
that
symbols.
Good. That reference probably addresses it sufficiently. Given all of that, is there anybody who still wants to hold off, or are you all okay with proceeding with this policy now and providing the board with the opportunity to take a closer look at how some of this will actually play out with the information from HR?
I did have one very small grammatical thing, and then just number 6, and again, kind of pulling from my knowledge at the city, I know when we wrote our own face covering ordinance, we were really mindful of how we left things a little too open-ended. Again, knowing that there are a lot of personal and strong feelings about wearing them or not. The way I guess question for the group here is number 6, which is there is a functional, practical reason for a staff member or volunteer to not wear a facial covering in the workplace. Is that too open-ended? Or is that another place where it would be supplemented with additional guidance from HR?
I would say this is an area that would be further supplemented by guidance from HR. Again, this is lifted directly from what the state put out.
And then my final one was just Oh, go ahead.
My reaction to that would be to leave it open as it is. I'm thinking about our career tech classrooms in which it may be important for those instructors at times to not have their face mask on if they're doing a particular run through of something that they're teaching the students.
This gives room for like eating and drinking too, for instance.
Okay, well, I'm comfortable if that just gets further clarified outside of this policy. I think that'll just be important for good adoption levels and everyone staying safe. So my other really small one is that the way that we've actually fixed the to not wear, we've created a split infinitive. So if we could change that one to not to wear, and then it also appears, oh gosh, somewhere else in this policy, I saw another instance of that, which I cannot find, unfortunately.
That would be in the second to the last.
Were we all holding back on this?
In the first line? An employee may request approval from the administration to not wear.
Thank you, Dr. Rush.
Do we want to update the language on those 6 exceptions to, right now they're all framed in terms of a workplace, but because it's also going to apply to students, it's not just a workplace for everyone? Or,
We should update it to make sure that it's inclusive language for our students and really reflects our learning community.
Mm-hmm.
So we can get through these. We can get through these one at a time. In the school setting, are prohibited by law or regulation, in violation of documented industry standards, not advisable for health reasons, in violation of the school's documented safety policies, may be removed when staff is working alone in an assigned work area. We could change that to when an individual is working alone in an assigned area if we want to make it more generic.
or is alone. Do we want to throw in like outdoor spaces there, for instance? I mean, I don't know if we do or don't, but you know, kids at recess, if they're far enough away, possibly that might be a time they could remove the mask.
You could say
I would want us to be mindful of the current OSHA regulations. So for example, with our athletes that are currently outside practicing in pods, they are still regulated to wear masks. And so I think we should be consistent with that particular policy.
So and hopefully this comes up, I just want to show everybody and tell me, do you all see the guidelines here from the state? So, you know, they're speaking more of staff. We've kind of expanded a little bit, but this is just how theirs is phrased here.
Are you sharing separate guidelines? I only see the policy that we're working on.
It's,
You pulled something else up. I can't see it.
how's that?
Great, thank you.
Okay. So we can certainly modify them. Again, when I did this, I lifted directly from the state's guidance because it's their direct guidance here. But we can certainly tweak it slightly. But we do start to move outside their recommendations at that point, or at least their requirements. A lot of things can be taken care of in guidance that goes above and beyond. I think what we were aiming for here is to make sure we're meeting the requirements that the state's put in place for a policy, that we have those criteria in our policy.
I wonder though, this guidance says that it's expressly for school staff. So if we're going to expand it to students, we might just want to use that term individual on district property.
We can do so. I'm going to stop this share. Oh, I did that wrong. My apologies. All right, we're back. So we can change staff in 5 to individual. That's if it, there we go.
Mm-hmm. I think those are helpful.
Might want to remove the workplace and just put in the at school at the very last word of 6. Maybe not in the school, but at school.
I want to make sure we capture, because we have people working not in schools too. So I got to make sure we capture both. Or maybe we just say we're in the workplace. Because I want to make sure we're capturing. I don't work in a school building. I work at the central office, and so we make sure we're. Oh, that did not go what I wanted to do.
Do we want to then, instead of referencing a school's documented safety policy, put in the district's documented safety policy? That's on number 4.
We could say that again. Facial coverings are in violation of the.
So if we want to make it
Districts.
not school specific, call it the district. Yeah.
Yeah. Oh, too many spaces now. Okay.
Oh, number 1 as well.
I wonder if in number 4, by taking out school,
But I just add that a little bit, make it different there. So we still are calling school. Because you could have it in a school setting, maybe differently in a district. I just want to make sure we're. But the district would have documented policies. They'd be district safety policies. Sorry, Ms. Klein.
so on number 4, do we need to say in violation of the district's or schools documented safety policies? Because do the career centers like downtown or Fort Hayes have other?
For some of those programs, there may be some additional. Better to be safe than sorry. I don't think it hurts.
Although in this case, we're talking about an exception, so that would make an exception potentially broader than. It'll only be as strong as the weakest one.
We could make we could make exceptions for that in guidance if we have career, and we'll make sure we reach out to our career tech folks that we're good to go there.
Could we go back up to number 1, Dr. Rouse? Could we
Sure.
change that to the facial coverings in the school or workplace, or figure out if we're just going to go with the district setting? Yeah, that looks better than the district setting.
I agree. I like that.
Would the workplace also qualify school buses?
It would, because that's a workplace for drivers.
Thank you. I just wanted to be clear on that. Because otherwise, I'd be more comfortable with district property. Even if it were an inclusion, so even if it were facial coverings in the school or workplace, school, work, comma, workplace, or district property. It's kind of belts and suspenders thing for me. I apologize.
So if we put district property, can we remove setting?
Yeah.
And then we would need to come down to 6 and make that consistent with school, workplace, or district property. School, workplace, or
My other thought as I was listening was trying to find that place where, and it might be in the very end, where it says a student or employee may request approval. Perhaps there should be some sort of language that states that individual is still required to maintain social distancing, cleanliness, that type of thing. So albeit you may, for whatever reason, upon approval, be nullified of the responsibility of wearing a mask or some sort of facial protection, you still must maintain, in fact, it's even more imperative that you maintain social distance and that you are clean, that your hands are clean, that kind of thing.
I just want to throw out there, though, that we might have students, for instance, who are deafblind, where that touch is an important part of another accommodations policy. So I would be hesitant to front load additional requirements into that interactive discussion. And just because you don't know what, you can guess, but you don't know what exactly the medical issue is going to be, or what the educational or workplace setting is going to be. I would just be hestant to.
I totally get you, and thank you for that. To me, it would be with guidance. So we could state in the language that with appropriate guidance, we still must maintain social distance, body cleanliness. We still must maintain that with guidance. So in that particular instance where there must be close quarter interaction, then that would mandate, more sensory interaction, touching, that kind of thing. But I think we could state with guidance, ...
So could we, at the end of that sentence where it says, and I apologize, I'm having a hard time seeing today, where it says applicable board policies for the student or staff member regarding such accommodations. Could we say something along the lines of promoting social distancing and or promoting safety precautions?
So the interactive process is always going to inherently include the concept is called direct threat. Does the disability related limitation or accommodations that are requested pose a direct threat to self or others in the employment setting? So that is, the safety issue is going to inherently be a part of any discussion about accommodations, not just is this accommodation that's proposed going to be effective? Can the district think of another one? But is this actually going to keep everybody safe? And is the proposed accommodation, is this an acceptable risk for both sides? That's going to be part of a discussion in every one of these exception cases, as long as the discussion adheres to the applicable board policy. But once again, like to front load, here are things that we will or will not accept without hearing that discussion or knowing what the particular circumstances are. I think I'm not sure if it should be in the overarching policy, although and I doubt that any of the district personnel who would be dealing with these would not be seriously considering all of these good points that you're raising.
So I think in hearing board member Cole's feedback, I think that it is important that we are intentional with the language. Adding promoting safety precautions ensures that not just our administrators that understand the guidance that will be taken, but it also communicates to our community members, our parents, and our students that even when accommodations are provided, measures will be taken to promote safety.
I hear you on that, but we've got the very second sentence of this policy says school settings are a source of community spread. Wearing a facial covering can be, like, I think that we've done a good job putting right up front and center the risk that we're talking about here. But the purpose of accommodations is not necessarily to promote safety precautions. It's to ensure that people can work in the workplace. The safety precautions are always going to be a part of that discussion, but that's not like it's a little awkward fit to say that that's the purpose of the accommodations discussion.
So you would like it placed somewhere differently. You don't want it at the end of that sentence.
No, I think that the sentence that says, in considering the request for accommodations, the district shall adhere to applicable board policies, I think that should be clean and standalone. And also, I'm just saying, like, presumably our board policy, if it's following what the ADA and 504 require, that policy inherently includes a discussion about health and safety. And we have preserved the importance of that by putting right up front in this policy, this affirmative statement that school can be the source of community spread and that wearing a facial covering is important. We've got it, we've covered it, we've hit that, it's there. And so requesting an exception to this policy,
no, not requesting an exception, but again, hearing the feedback of board member Cole, wanting to ensure that we're very intentional. And I'm one of the people that firmly believe it's okay to over communicate. Is there another place, and board member Cole, please feel free to jump in, where you would like that stated? Again, trying to be mindful of your feedback, that you want us to be very intentional, ensuring that safety precautions are followed.
No, I appreciate you. I'm looking at the sentence that says, in considering the request, the district administration shall adhere to the applicable board policies. I think that should also include state and federal mandates or regulations. And then to me, that then would cover the whole promoting of safety precautions that entail social distancing and body cleanliness.
I did like the idea of putting that in that second sentence, just because nowhere else in this policy do we state that actually those things are essential for everyone,
Yes.
rather than just emphasizing it for those who might require accommodations. Face masks, face coverings are a part of what protect us alongside social distancing and basic cleanliness. So I think maybe affirming that up top, Emily, I don't want to speak for you, tell me if I'm wrong here, would kind of alleviate your concern about singling out those who do need accommodations with language that still may not meet the accommodations they do need. So I like it in that second sentence.
I think that's a good suggestion. Go ahead.
Yeah, I wouldn't want to be in this policy where we're directing to use an otherwise standard policy. I don't think this policy should put a thumb on the scale of that discussion more than what we've already said, which is this is the rationale for this policy in the first instance. So in considering an exception for that, obviously we need to think about what's the purpose for that policy in the first place. And how can that, and it's a safety matter. And I think that does that. It's just, we need to have something that directs to the board policy for how accommodations requests are handled. And I think that should be, very clean and clear. I wouldn't want to try to modify how the board is going to otherwise, look at another policy, especially when that policy inherently is going to bring a discussion back to what's the purpose for the policy that you're asking for an exception from in the first place.
Excellent job, Dr. Roush. That sentence is right on point.
So based on the comments from Board Member Cole and Ms. Ellingson and Ms. White, Dr. Pierce, I went ahead and all of that kind of amalgamated that to social distancing when possible, and continued sanitary practices such as regular hand washing are also important in helping to mitigate the risk of exposure from person to person.
That's it. And then keeping that last sentence, in considering the request, that accommodates, that incorporates, excuse me, the state and federal piece
Mhm.
in inclusion with our policies is very helpful.
Are we good then to take out the promoting safety precautions?
Yes,
Yes.
good suggestions, everybody.
Just again on that second sentence, it's hard not to think about COVID-19, but we're writing a policy about health emergencies. So just as a small note, wearing facial coverings is especially important during these times. Maybe we could just say during health emergencies.
I like that much better.
I like that much better. That's a great addition, Kelsey.
And then I also wanted to just lift up that, at least by how it reads to me in that first sentence, the following policy shall apply whenever a health emergency, including a pandemic or epidemic, is declared by the appropriate federal, state, or local agency. By my read of that, you can't move forward with this facial covering policy without a declaration from one of those agencies. So I just want to put that out there and make sure that we're all okay with that. Of course, those entities mentioned are important voices. We know just from how we've watched things unfold that some are inclined to move quickly or more slowly about this particular issue. So the question is, does it really make sense to pin the district's ability to make use of this policy to those agencies listed?
I guess my only question would be if another appropriate entity that has the authority to declare a public health emergency, we could implement this at any point in time, health emergency or not. We could require under this, we could essentially require face coverings at any point in time. And if that's fine, if the board is good with that, it's flu season and you have a superintendent who's like, we're going to be super careful and mitigate the spread. Everyone's wearing masks all, from November until March. That was that's the only reason why that's in there, but I am open to other suggestions. Was just that, really kind of limiting the requirements here, or the authority here for the superintendent to just those actual kind of health emergencies as determined by the appropriate public health entity, whether that's Columbus Public Health, the Ohio Department of Health, the CDC.
You actually, in that third paragraph, you have beautiful language that says the superintendent, upon consultation with the appropriate federal, state, or local health officials, may require that facial coverings be required. So I think that actually is the correct threshold, is that you shouldn't be trying to implement this willy-nilly. It should be in consultation with people who know. But I guess I'm just suggesting that you give yourself a little bit additional flexibility, that if, say, Columbus Public Health does want to advise face masks, but for some reason, a local health emergency hasn't happened yet, or this would give you some flexibility to be an early adopter.
I think it also speaks, Kelsey, this point also speaks to what do we mean by a declaration? When is it declared? How do they declare it? Just that word alone, I think we need to be very intentional. So I agree with Kelsey's recommendation that language of in consultation with is good language to use. Great note, Kelsey.
So you would advise to delete the first sentence in its entirety.
Or just rewording it to say that we may take, not using this exact language, but that we would possibly take cues from those entities. But you mentioned a pandemic or epidemic. I think that that's a good descriptor of what we mean here.
Is that closer?
I like that, but maybe, and again, eager to hear other voices on this one,
Yeah.
shall apply during a health emergency, including a pandemic or epidemic, or as otherwise declared by the appropriate federal, state, and local agency. So again, saying you can take cues from them, but you aren't limited to when they want to declare something.
No, yeah, it's certainly much broader.
I don't know. I'm a little confused. It sounds like a chicken or the egg type situation. I'm just trying to I'm trying to distill where you're trying to go with it. But to me, if a pandemic, if it's during an emergency such as a pandemic or an epidemic, that means that it already was declared. So the following policy shall apply during a health emergency, including a pandemic or epidemic. If you were just going to have that period, then to me that would be fine. And then again, that is supported in the, what is the third paragraph, or excuse me, hold on. Where is it, Michael? And I'm sorry, I'm having a little vision issue today as well. But there was something that stated language about the appropriate health people. Thank you, Dr. Roush. Superintendent, upon consultation of appropriate federal, state, or local health officials may require. So in that second paragraph, the superintendent, to me, this kind of foundations, as you were thinking, Kelsey, about this first statement: the following policy shall apply during a health emergency, including a pandemic or epidemic. That should be stand alone by itself, because if you're saying or otherwise is declared by the appropriate federal, state, or local agency, it was already declared. So if we're in a pandemic, if we're in an emergency, an epidemic, my thought is that it's already been declared. Am I off with that or not? I mean, it's not a hill to die on, but to me, it's just one of those chicken or the egg conversations. I think the egg has already been hatched when an emergency or an epidemic is, we're already in the midst of that. I think it's already been declared. But
yes, but I think when Kelsey initially raised that concern, again, the language of declared and what entity is declaring it a state emergency. And I'm paraphrasing, if I recall, she indicated you might have one agency declare an emergency, but for example, our federal level not declare an emergency. So at what point does it justify us putting this policy into play?
no, I hear you. Again, it's stated right there in the top of the second paragraph, where she says the superintendent, upon consultation with the appropriate federal, state, or local health officials, may require the facial coverings mask be required of all blah, 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 right? So
yes,
it already says right there, in consultation with the appropriate health officials.
So this might be,
yeah.
I see that sentence as a preamble, as Eric would call it. That's just a little introductory sentence to get the policy going. I think Dr. Roush asked us, did we want to strike the whole sentence or did we want to leave it in
I
there?
want to strike it. I think it's appropriate, but I was just wondering again, is it necessary to include or as otherwise declared by appropriate federal, state, or local agency if this policy applies during a pandemic or an epidemic? And to me, that's already being declared.
Well,
So I guess-
let me ask Kelsey, and I see you were about to speak. Were you thinking of situations where there may be a health emergency, at least in the from the superintendent's perspective, but there has not been a declaration by any of those?
So, I mean, sort of. I mean, to be frank, I can say we've all witnessed a leadership vacuum at higher levels of government and a reticence to listen to people who actually understand health. So in my mind, where I was going with this is how do we insulate against such a future failure? And so another question that's in my mind, this is the first pandemic that I've confronted. I think it's the first pandemic most of us have confronted. But maybe there's a world in which there is a health emergency that is neither a pandemic nor an epidemic. So I think just broader language here is what I was going for, to ensure that you as a district have the latitude to demonstrate early leadership now that we have a very recent reminder that sometimes you can't expect it from other places.
Yeah, that's what I thought you were talking about, and I agree, and I think that for those reasons that what we have here now covers that and allows the superintendent that flexibility. The only further change that I would make is to the title and taking out the word declared.
Mhm.
I might suggest as well that on our second paragraph, talking about community spread, that we might just specify community spread of a respiratory illness, because we've got something broad enough. Pandemic and epidemic might also include health conditions that are not contagious with community spread of a respiratory illness. But our face covering policy should absolutely be applicable to that. We might have an epidemic of diabetes, but wearing a face mask is not going to protect students from it because it's not contagious.
Mhm.
Okay, yeah, I like the language, Dr. Rouse, for certain illnesses. I thank you. I appreciate that. I think that's appropriate.
Should we change that from an is then to may be especially important? Because again, for other things that may be an epidemic or maybe facial coverings may not do anything.
Could we say could be wearing a facial covering can be an important public health measure to protect during a health emergency?
During health emergencies there. You clear that space between coverings and can. Yeah.
Thank you.
In that same vein, thank you for raising that, Emily. The first sentence means that this policy does apply during any health emergency, rather than those for which face coverings would be appropriate. So if there's I know that sits alongside that third paragraph about consultation with health officials. If folks think that that's sufficiently balanced, then I'm fine to leave it. But otherwise, yes, right now we could be instituting face coverings for something that isn't helped by face coverings. So it would be the following policy may apply, or we can say it shall apply during a more specific health emergency. I'm just not the appropriate person to articulate that language.
I think that's where that third sentence helps, or that third paragraph helps, where it says they may require facial coverings. They're going to consult on them. So you may have a particular health emergency, but if the health department or health officials are saying, yeah, facial coverings aren't going to do anything on this one, then we wouldn't implement this. Now, unfortunately, that may mean we may be back at some point dealing with some other kind of policy to deal with whatever else we may need to do for the next illness. But let's try to have happier thoughts on a Friday.
I'm fine with that.
So during a health emergency, is there need to be any more definition to what a health emergency is or constitutes a health emergency? because it's no longer declared. It's not a declared health emergency. So when does the policy kick in? Who determines the health emergency? I guess is it the superintendent then is determining that health emergency in consultation with folks. I'm fine if that's what it is. I just want to, are we good? Do we feel we've got a solid definition or when this policy takes effect? Because the board is essentially delegating an authority to the superintendent here.
I'm good with it. I feel comfortable in the superintendent's ability to, in consultation with our local agencies, determine when to put this policy in effect.
Okay.
I agree. That's what I was looking at. All right. Are we ready to proceed with this?
I'm comfortable.
All right. Do we have a motion to approve the policy with all of the changes that we've made to it?
I motion that we approve policy 845001 with all of the changes.
Second.
Roll call, please.
Chair Brown,
Yes.
Board Member Cole,
Yes.
Dr. Pierce,
Yes.
Ms. Klein,
Yes.
Ms. Ellingson,
Yes.
Ms. White.
Yes.
That motion carries.
Wonderful. Thank you all. Let's turn to the next policy, which is new and doesn't yet have a real policy number on states of emergency. Dr. Roush?
Thank you. This was this went through a subcommittee that Ms. White, I think, helped lead that particular discussion. You know, as we moved into these uncharted waters, felt that there was a necessity. The committee felt that there was a necessity to have a policy on states of emergency. The subcommittee worked a good, I think, hour and a half on making sure that we had some good language here that would kick into effect whenever there was. You know, there was an emergency declared before the board could meet, so the superintendent could take certain actions. Ms. White, I'll let you add anything else you would like to do so here. I think that the policy is fairly self-explanatory, but please.
Sure, and I would like to acknowledge also a lot of the concerns that Kelsey was just raising with respect to who declare, you know, what do we do in a vacuum of power of other authorities? You know, this policy kind of speaks to and anticipates that as well. So the idea here is to delegate authority to the superintendent to really specify when that delegation would happen, and also put into place a policy to make sure that the board and the public can be informed and have input on you know, the exercise of emergency powers. One of the things that we were discussing is when should a state of emergency be declared, and to be wide enough to encompass many different potential issues, from a school shooting to a pandemic to, I mean, there's lots of things that might be in a state of emergency, but we narrowed down to what we're really talking about is an imminent, immediate threat to the welfare or safety of students and employees. And so then we acknowledge that this might be something that's declared by the city of Columbus, the state of Ohio, or the federal government, or this might be an issue that is really a purely almost local concern to our district. So what we do is authorize the superintendent to declare a state of emergency for the imminent threat of health or safety. And then we say that the superintendent may basically rescind you know, any ordinary policy or procedure, but that has to be immediately reported to the board. The reasons for that suspension have to be explained, and essentially the state of emergency is only going to last until the next board meeting. And at that board meeting, the superintendent should be able to explain the reason and the purpose for the suspension of any rule. And this gives the board an opportunity to ratify and approve whatever change is going to happen going forward, because we don't want a situation where a superintendent can indefinitely suspend any rules or regulations that would otherwise apply. And it really gives the board control and agency over approving those decisions going forward. We also thought it was important to get public feedback in the event that a state of emergency is declared and any policies or rules are suspended. So we put a provision in here to provide public notice of such state of emergency and suspension of policy. We wanted to make sure that this is broad enough to encompass, there might be a state of emergency where things are moving fast, where a school has to be closed. Once again, immediately notify the board. And then we had a discussion about what to do during the state of emergency, what sort of guidance to require. And so we have a cooperation with emergency management authorities. There was some debate on that about what extent cooperation should be required. Our old policy had expressly said that they shall cooperate with law enforcement. But after discussion, we propose that there will be cooperation with emergency management authorities here. And then also, in the event that a school's closed, we have, the superintendent shall designate appropriate staff to secure district property and facilities. And then finally, we have a section just sort of encouraging our superintendent to base decisions on their best judgment, which of course they need to do, but somebody who needs to move fast in the event of an emergency like a school shooting or a flood or a tornado that hits a building, we want to make sure that the superintendent feels free to take the actions that they believe in their good judgment are necessary to protect the health and safety.
And Mr. Chair, I believe that Mr. Hayes had raised an issue with me once before, and I don't know if he's still on here, if he wants to raise that particular. He already has. He's beat me to the punch in the chat. So
Yes, he has. Yes, he has.
and just for those listening at home, the question is, what if the superintendent wants to suspend this policy, but the suspension conflicts with a collectively bargained agreement? And so I know that was a concern that he had raised as far as not being able to suspend items that conflict. And I'm gonna. It's Friday. Essentially, suspend any policies that would in turn conflict with the collective bargaining agreement.
That's an interesting question and a good one. Thank you, Phil. I don't know the specifics of the collective bargaining agreement well enough to know, but is there a provision anywhere in the agreement that addresses emergency or emergency situations that allows for that specifically within the agreement allows for a change?
Board Member Brown, I think Phil Hayes has put in the chat box, for example, a visitation policy.
Yeah, I see that. And he says there's a process for changing them and modifying the agreement. But I guess my thought is this is an emergency and must be acted on quickly. And I don't know what the process might be, but I suspect that it would be a process that takes too long or could take too long for the situation.
I mean, Phil, are there particular provisions in the CBA that you would be concerned that might get that has the potential to get waived? I mean, you mentioned the visitation policy.
Is Phil able to speak with us?
Phil, you want to jump on camera?
Hello, everyone. Good morning.
Thank you, Phil.
So it just there is a process for modifying the agreement. I just wanted to make sure that, that the temporary suspension of any policies of the board itself would not impact any collectively bargained agreement, either with the association or with my OPSI brothers and sisters. And Board Member Brown, to your point, I understand that the concern about it taking too long. I think within the current context of our climate, I think we've been able to quickly and effectively address the issues through the collective bargaining process that need to be addressed. But at the same time, the contract itself, suspension of a policy which is directly referenced in the contract, or suspension of a policy to which the contract applies or applies to the contract, would violate the contract and can't be done unilaterally. Just as if we could for the association for CEA, we couldn't, decide to not follow a part of the contract for 2 weeks. Same thing with the revocation of a policy.
Are there particular, I just want to make sure whichever way we go, or if we need to make some clarifying language, I just want to make sure, are there policies that could impact health or safety? What I want to do is, if there's an emergency situation and we say you can't violate if it's a policy, I'm making up words here as I go. It essentially, you can suspend only those policies that don't conflict with the collective bargaining agreement, or something like that. Are there any policies in like an emergency situation where we may have an imminent threat situation that we couldn't suspend that policy, and so then we could actually have a detrimental impact on trying to address that particular emergency situation? I just want to make sure we're not inadvertently missing something, or if we have to carve out an exception, we can do that.
My suggestion, if I may, would be something along the lines, in accordance with the collective bargaining process or some such thing along those lines, to insert that in there. Because if there is a need, obviously the superintendent would call the association president and say, hey, we need to do this for this period of time. And obviously, if it's for health and safety and student welfare and staff and community welfare, it wouldn't be there would be some kind of collective bargaining process behind that. It wouldn't be an absolute refusal. It would they're just, again, just respecting the integrity of the negotiated agreements.
We really tried to, knowing that these are unknown unknowns about what kind of situation might come up, we wanted to make sure that it was really narrowly tailored enough so that it wouldn't just, there wouldn't be a complete lack of discretion about declaring it health or safety. It has to be imminent, something that's going to happen immediately. And it has to be welfare and safety. And there has to be this notice in writing, specifying which policies would be suspended and giving the factual predicate, like what's the basis for suspending this policy. We wanted to make sure that, you're right, this is a really an enormous delegation of responsibility to make this kind of determination. And so we wanted to make sure that it could only be used in the most limited circumstances and with really robust due process and public participation requirements. Maybe the collective bargaining piece could be expressly referenced in addition to informing the board and informing the public that my preference also would be to reference whatever the existing policy is. So if the collective bargaining agreement includes a notice requirement, to expressly incorporate that in this piece and use a process that's already been bargained for and worked in the past.
That makes sense to me. A couple of things. I too saw the notice provision as a place to do that and to notify the association leadership for each of the unions. But also, I'm wondering, and since we've got several lawyers on who are smarter than me on these matters, that is there an emergency, is acting on an emergency inherently allow deviation from the collective bargaining? Our agreements, does it supersede, I guess? Dealing with an imminent threat to safety. does that, I guess, automatically allow deviation from the CBA?
Is there a force majeure clause in the CBA?
Phil, do you know?
I'm not aware of that, of any clause in the contract that would allow the superintendent to suspend any part of the policies that would conflict with the collectively bargained agreement. Once it's executed, it's in full force and effect until both parties agree to modify it.
So can I ask a question while we're having this discussion, and maybe this will help to move the discussion forward or just add an additional caveat. When we have lockdown situations in our schools, how is a lockdown situation any different from this state of emergency? One, as I thought about it, the principal moves forward to declare the lockdown versus the superintendent. The principal informs the superintendent of the situation in the school or around the school. So how does this then align with that policy and procedure? And in that particular instance, we do change the visitor policy. No one is allowed in the building. Students are not allowed out the building. Even if I went to pick up my child, I have to wait until that lockdown has been lifted.
That was precisely
the instance I'm thinking about. That collective bargaining agreement has been suspended, and it's been done so very quickly. And in that particular instance, I'm also seeing that the superintendent isn't declaring the state of emergency.
One of the thoughts of the committee, though, was that is a decision that needs to be elevated to the superintendent as soon as possible. It's really about establishing like who owns this decision. And of course, depending on the timing, the imminence, the type of harm, things might move very fast, but as quickly as possible, this should be run up the flagpole to the superintendent and ultimately to the board to ratify whatever the decision is made. That's being made.
So in that particular instance, I'm thinking of, again, if we have a school shooter situation, if we have shots fired in a neighborhood, I want the principal to be able to act immediately. And from my understanding, principals do consult with the superintendent, but the principal has been trained, has been provided with such supervision and guidance on how to specifically address each situation, that I would not want our staff, our principals to be hindered by getting in touch with the superintendent or designee.
Would it make sense then to add really a new shorter procedure to sort of skip the intermediate step of the superintendent and actually expressly empower principals to make those decisions, but still require the same notification, due process, emergency elevation to the board? I mean, I hate to think of a principal hesitating for even a moment to exercise the power to protect a student or staff member without thinking that the board is going to have their back and that you know what I'm saying?
Mm-hmm. So I think Phil Hayes has put in the chat box a really good point of distinction with the particular example that I'm bringing to bear. In a lockdown or school shooter situation, there's policies, there's practices that are followed. This particular procedure is saying to suspend policies.
It is a may suspend policy, and I think that again, if we delegate anything to principals, that authority needs to be reserved only to the superintendent. I would be very hesitant to, I'm sure the board would be as well, to suddenly delegate the authority to suspend policies to folks that are not the superintendent or in
Or the Board of Education, and I agree.
Let me ask this at this point, since we're closing in on 10 o'clock. And clearly we won't be getting this one completed today, which is fine. Are there any we'll take a closer look and give some thought to the interaction between this policy and collective bargaining agreements. I think that's a good one to think on. Are there any other aspects of this policy that anybody suggests that we're going to need to look at?
Yes, I think it's important to see how this policy aligns with other states of emergency. To me, a lockdown is a state of emergency, and I want to make sure that both of those policies are consistent and speak to one another. There are instances in which policies are suspended or other policies are immediately put into place. So I want to ensure that we have consistent, intentional language of across both policies.
Okay.
That's a good catch. Thank you.
Yeah, we'll do that. Very minor, I think. Second paragraph where it says threat to the welfare or safety of students and employees. I think it should be an or rather than an and.
Here,
No, I was looking above there. Well, both places.
got it.
So we will work on those things and consider this again when we next meet on the 13th of August. That will be about just under 2 weeks. In the meantime,
Brown, before we end, I think we have one more language change. This is coming from our Office of Internal Auditor.
yes, I'm just looking at that.
Maybe we could do, we've already included to the extent necessary to protect the welfare. Should we put to the extent and only so long as it is necessary?
I feel better with that language.
Sure.
And only so long as.
Mm-hmm. I think that addresses Kevin's point.
I can just add one last comment. I don't want to overlook the concerns stated by our friends in labor. And I was just looking through the collective bargaining agreements that we have for some of the various units at the city, and they do contemplate states of emergency to some extent. So I really would urge us, again, I'm not a labor attorney, and that's where I'll go with my point. But if something is contemplated in the CBA, such as how someone should be able to be called back into work, I don't think you can just have something from the superintendent come down to say what has previously been agreed to no longer is in effect, unless of course there's a provision in there that says under a very specific circumstance that isn't allowed. So I would just want to lift up that it may be an outcome that we can go as far as we can with this policy, and subsequently we'll need to have a new conversation within the next bargaining process to make sure that what's in there aligns with the needs in this specific scenario.
Excellent point, Kelsey. I agree.
Yeah, clearly we need to be respectful of the agreement and our relationship with our employees and staff and the unions representing them. So let's take a look at those and give some thought to it, and we'll discuss that further when we next meet. And we've also, I had forgotten until I saw in the chat that James Barnes, our general counsel, is on with us, and he too can share some thoughts as we move forward. Is there anything else for today?
Motion to adjourn.
Before we do that, can I just, so today is Friday. This committee has met twice this week. The work that we do not only involves coming online and having these discussions, but also doing research before coming to this table for discussion, whether that research is to give feedback and input, or as Emily has done, create policy for all of us to kind of lean in on and give feedback. So I just want to thank everybody for their continued dedication, commitment to show up today on a Friday, to do the work that's needed to be done to move our district closer to success. So thank you, everybody.
Thank you, Tina.
Thank you.
Well said. All right,
We all didn't get beautiful hugs like you did this morning, Eric. We didn't camera. I had to tell Michelle I'd give her a hug when she come home. You got your hug.
Well, I look forward to the time that we all can do that again. With that, all in favor of adjournment?
Aye.
I'll second, just in case you need it for the record. Michael made the motion. I'll second. All in favor?
Yes.
Aye.
Any opposed? Have a great weekend and stay safe and healthy. Thank you all.
Everybody, thank you.
Thank you.
Bye, everybody. Thank you.
Paul, let us know when we're clear, please.